Good morning to all. I am SUBA RANI, Associate Professor, Emmanuel College of Pharmacy. Today's topic is gastrointestinal agents. Part 1, already we have studied gastrointestinal agents, part 1. Then today we study gastrointestinal agents, part 2. First of all, aluminum hydroxide. Aluminum hydroxide. The molecular formula is AlOH thrice. The aluminum hydroxide is non-absorbable antacids. Okay. The molecular weight is 77.99 gram. Molecular formula AlOH thrice. Okay. The properties. It is a white viscous suspension. Small amount of clear liquid may be separated on standing. It is translucent in nature. The pH of aluminum hydroxide is 3 to 5. It is sweet in nature due to sweeting agent. So aluminum hydroxide is a sweeting agent. It does not affect phenolphthalein indicator. In titration, aluminum hydroxide does not affect phenolphthalein indicator. It is insoluble in water and alcohol but soluble in mineral acid. So these are the properties. First of all, white viscous suspension. The small amount of clear liquid may be separated on standing. It is translucent in nature. It has pH between 3 to 5. It is sweet in nature due to sweeting agent. It does not affect phenolphthalein indicator. It is insoluble in water and alcohol, but it is soluble in mineral acids. Uses of aluminum hydroxide gel. It is a non-systemic or non-absorbable antacid. Aluminum hydroxide gel is a non-systemic or non-absorbable antacid. Externally, it is used as mild astringent and it is used in the treatment of diarrhea and cholera. Externally used as dusting powder. So these are the uses of aluminum hydroxide gel. It is non-systemic or non-absorbable antacid. It is used as mild astringent. It is used in the treatment of diarrhea and cholera. Then externally it is used as dusting powder. So these are the uses. Then storage. Aluminum hydroxide gel is stored in the gel should be stored in temperature not exceeding 25 degrees Celsius and it should not allow to freeze. So aluminum hydroxide gel should be stored at a temperature not exceeding 25 degrees Celsius. It should not allow to freeze. Then magnesium hydroxide mixture. The molecular formula of magnesium hydroxide is MgOH twice. The molecular mass is 58.31 gram per mole. Magnesium salt, that is Mg2 plus salt, or magnesium oxide MgOH twice, MgO. Then magnesium hydroxide MgOH twice act as both antacid and laxative effect. So magnesium salt and magnesium oxide and magnesium hydroxide, this all of act as both antacid and laxative agents. The properties of magnesium hydroxide. Appearance. It is a white amorphous powder. Odor. It is odorless. Taste. It is tasteless. The melting point of magnesium hydroxide is 3500 degrees Celsius. It is insoluble in water. The refractive index is 1.55. So magnesium hydroxide, the molecular formula is MgOH twice. Mass 58.31 gram per mole. The magnesium salt and magnesium oxide and magnesium hydroxide both act as both antacid and laxative effect. Properties. It is white amorphous powder. It is odorless. It is tasteless. The melting point is 3500 degrees Celsius. It is insoluble in water. The refractive index is 1.55. Preparation. Magnesium hydroxide is prepared by the combining solution of many magnesium salt with basic water. Magnesium salt Mg2 plus basic water OH minus gives MgOH twice. So magnesium hydroxide is prepared by the reaction of magnesium salt with basic water. Mg2 plus 2OH minus gives MgOH twice. Then uses of magnesium hydroxide. It is used as weak antacid and laxative. Most commonly used antacids combined aluminum hydroxide and magnesium hydroxide. Most commonly used antacids are combined aluminum hydroxide and magnesium hydroxide. The combination decreases the adverse effect of diarrhea and constipation. The combination decreases the adverse effect of diarrhea. The combination of magnesium products and constipation. It decreases the effect of constipation. The drug aluminum product. Calcium carbonate is effective in relieving heartburn. Calcium carbonate is effective in relieving heartburn, but it is infrequently used to treat people ulcers. So, uses of magnesium hydroxide. It is used as weak antacid and laxative. It is most commonly used in antacid combined aluminum hydroxide and magnesium hydroxide. The combination decreases the adverse effect of diarrhea with the magnesium products and the constipation with the aluminum products. The calcium carbonate is effective in relieving heartburn. So it is used to treat peptic ulcers or GERD. Then cathartics. These are the drugs which give relief from constipation, or these are the drugs which brings defecation. Okay, these are the drugs which are used to relieve from constipation, or these are the drugs which brings defecation. Mechanism action of cathartics. First point is bulk producing drugs. These drugs promote evacuation by increasing the stool bulk, volume and water content. Bulk producing drugs. These drugs are promote evacuation by increasing the stool but volume and water content. Example, esophageal agar-agar methylcellulose. Okay. Then second, stool softness or emollient. It penetrates lubricants and softens the stools. Stool softener or emollient. It penetrates lubricants and softens the stools. Examples of stool softener is liquid paraffin and mineral acids. Okay, then first bulk producing drugs, then second on stool softeners. Third, stimulant or strong purgative or irritant purgative. Stimulant or strong purgatives, irritant purgatives. It causes local irritation on the intestinal tract, which increases peristaltic activity. So, stimulant or strong purgative or irritant purgative, it causes local irritation on the intestinal tract, which increases peristaltic activity. Example, phenolphthalein, senna glycosides, aloe, rhubarb extract, castor oil, etc. These are the stimulant or strong purgatives. Then fourth one is osmotic laxatives or saline cathartics. Fourth one is osmotic laxatives and saline cathartic. These are the salts of poorly absorbable ions which increases osmotic lead on osmotic load on intestinal tract, which is relieved by secretion of addition fluids in the intestinal tract. Hence, these agents increase fluidity of intestinal tract by retention of water by osmotic forces. So, the osmotic laxatives are these salts are poorly absorbs of ions, so which increase the osmotic load on intestinal tract, which is relieved by secretion of additional fluids in the intestinal tract. Hence, these agents increases fluidity of intestinal tract by retention of water by osmotic forces. Example: antimony potassium tartrate, sodium phosphate, magnesium sulfate, sodium sulfate, potassium phosphate, etc. These are the examples of osmotic laxatives. What are they? They are antimony potassium tartrate, sodium phosphate, magnesium sulfate, sodium sulfate, potassium phosphate, etc. Then laxative. Next topic is laxative. Laxatives are substances that loosen stools and increase bowel movement. So, laxative are substances which that is to loosen the stools and increase the bowel movement. Loosen the stool and increase the bowel movement. They are used to treat and prevent constipation. Laxatives are used to treat constipation. So, laxatives are substances that loosen stools and increased bowel movements. These are used to treat and prevent constipation. Then classification of laxative. Bulk producing drugs. Then stool softeners. Strong purgatives. Okay, first one, laxatives. Laxatives are two types: bulk producing things, then stool softeners. First of all, bulk producing drugs: isofagol, agar-agar, methylcellulose, sodium methylcellulose. Bulk producing drugs: esophageal, agar-agar, methylcellulose, sodium carboxymethylcellulose. These are the examples of bulk producing drugs. Then stool softness or emollient. Example: liquid paraffin. Stool softness or emollient. The example is liquid paraffin. Then strong purgatives. Titrant or stimulant purgatives: senna glycosides, phenolphthalein, aloe, castor oil, and rhubarb. These are the example of titrant or irritant or stimulant purgatives. Then saline cathartics or osmotic laxatives. So strong purgatives are two types. First one is irritant or stimulant purgatives. Then second one, saline cathartics or osmotic laxatives. Sodium containing products: sodium potassium tartrate, sodium phosphate. These are the example of saline cathartics. Then magnesium containing products: magnesium hydroxide, magnesium sulfate, etc. Then sulfur as cathartic. Non-official cathartic: sodium sulfate, potassium phosphate. The example of non-official cathartic: sodium sulfate and potassium phosphate. So laxatives, there are main classification is laxatives are bulk producing drugs, stool softeners. Okay, then second, strong purgatives, sulfurous cathartic, non-toxic cathartics. Okay. Then magnesium sulfate. The molecular formula of magnesium sulfate is MgSO4 7H2. The molecular weight is 246.47. Another name of magnesium sulfate is Epsom salt. Properties: it occurs as colorless crystals with a cool saline and bitter taste. The taste of magnesium sulfate is saline and bitter taste. It is colorless. It efflorescence in dry air. It is freely soluble in water. It is sparingly soluble in alcohol and dissolves slowly in glycerin. So these are the chemical properties. Molecular formula magnesium sulfate is MgSO4 7H2O. Another name is Epsom salt. Properties: it is colorless crystal with a cool saline and bitter taste. It is efflorescent in dry air. It is freely soluble in water, sparingly soluble in alcohol, and it dissolves slowly in glycerin. Okay. Uses: magnesium sulfate is used as a saline catalytic. Magnesium sulfate is used as a saline catalytic. It is not absorbed in intestinal tract, so it increases the hypostatic pressure on increase and decrease. It is not absorbed in intestinal tract, so it increases the hydrostatic pressure on intestine and increase the peristaltic activity. So it is not absorbed in intestinal tract, but it increases the hydrostatic pressure in intestine and increases the peristaltic activity. So there are two processes. First of all, increase hydrostatic pressure, increases the hydrostatic pressure on intestine and increases the peristaltic activity. Okay. Then second one, it is also used as an antidote in heavy metal poisoning. So magnesium sulfate is used as an antidote in heavy metal poisoning. Wet dressing of 25% solution of magnesium sulfate are sometimes used in the treatment of carbuncles and boils. Carbuncles and boils. Okay, it should be used with care as a laxative in patient with impaired renal function. So wet dressing of 25% solution of magnesium sulfate are sometimes used in the treatment of carbuncles and boils, and it should be used with care of laxative in patient with impaired renal function. Then storage: it is stored in airtight container. It stay in cool place. Then kaolin, the molecular formula of kaolin is Al2O3 2SiO2 2H2O. Molecular formula is 258. It is China clay. The properties: it is occurs as a soft white or yellowish white powder. Soft white or yellowish white powder. It is colorless and has clay-like taste. When moistened with water, assumes a darker color and it develops a marked clay-like odor. When moistened with water, it assumes a darker color and it develops a marked clay-like odor. It is insoluble in water, in mineral acids, and in a solution of alkali hydroxide. So it is insoluble in water, in mineral acids, and in solution of alkali hydroxides. Chemically, it is practically inert, since it is insoluble in all the common solvents. Okay. Uses: it is used in mixtures intended for treatment in dysentery, diarrhea, and for symptomatic treatment of colitis, cholera, etc. So the uses of kaolin: it is used as the mixtures intended for treatment of dysentery, diarrhea, and for symptomatic treatment of colitis and cholera, etc. It is employed in the treatment of food and alkaloidal poisoning as it absorbs toxins. It also finds use in dusting powder, cosmetic preparation, and as an ingredient of kaolin poultice. So it is also finds use in the dusting powder, cosmetic preparation, and is an ingredient of kaolin poultice. So next one is bentonite. It is also called as Montmorillonite. Montmorillonite. It is a clay. Bentonite is a clay and is formed from volcanic ash and water. So bentonite is a clay. It is formed from volcanic ash and water. It is a phyllosilicate which has absorbing powers. Different types of bentonite are each named after the respective dominant element, such as potassium or sodium or calcium and aluminum, etc. It has been used in many countries to promote colon cleansing. It is a colloidal hydrated aluminum silicate official in USP, and it has been used for years traditional medicine as a natural cathartic. Properties of bentonite. It occurs as a pale buff or cream colored powder. Bentonite is pale buff or green colored powder. Freely from grit, having activity. Taste is hygroscopic. Its nature in nature. It is insoluble in water but swells to approximately 12 times its volume when added to water. It is neither soluble nor swells in organic solvents. It is aqueous suspense in alkaline pH 3 to 10. Okay. These are the properties of bentonite. Then disodium phosphate or dibasic sodium phosphate or disodium hydrogen phosphate. Disodium phosphate. Molecular formula Na2HPO4 7H2O. Disodium phosphate. The molecular weight is 268.07 gram per mole. Contains its NLT rate 98.5% and NMT 101.0%. Disodium phosphate on dried basis. Then preparation. It is prepared by the action of phosphoric acid H3PO4 on sodium carbonate Na2CO3. Neutralization and concentration of the solution yields colorless granular salt. So phosphoric acid is reacted with the sodium carbonate to form disodium phosphate with water and carbon dioxide. Then properties. It is a color light white granular salt. It effervescence in dry air. It is freely soluble in water and slightly soluble in alcohol. It is its aqueous solution is basic in nature. Okay. Then purity. First of all, identification test. 10% weight per volume of solution should give confirmative test for sodium and phosphate. Then pH 2% aqueous solution should be pH 9 to 12. Test for purity. Heavy metal as well as calcium, magnesium and magnesium and ions like chloride, sulfate and loss on drying. So test for purity. Heavy metals such as lead as well as calcium, magnesium and ions, calcium, magnesium and ions like chloride, sulfate and loss on drying. Then assay of disodium phosphate. Sample solution in water is titrated against 0.5 normal sulfuric acid H2SO4 using bromocresol indicator as a green color is formed. Okay, then sample solution in water is titrated with 0.5 normal sulfuric acid, brings bromocresol green. Okay, the end point is a bromocresol indicator is added, the end point green color is obtained. Na2HPO4 plus H2SO4 gives 2NaHSO4 plus sodium sulfate Na2SO4. Okay. Then each ml of 0.5 normal sulfuric acid equal to 0.0071 gram of disodium phosphate. Okay. Then application. It is poor absorption in the gastrointestinal tract. It is considered safe and it is widely used because of its poor absorption, the gastrointestinal tract is considered safe and it is widely used as saline cathartic or laxative. It is an important component of phosphate buffer. Okay, disodium phosphate is an important of phosphate buffer. Okay, student, today we are discussing gastrointestinal tract agent part 2. So many other examples are we discussed. First of all, aluminum hydroxide, ALOH price. Then it is discussed the physical properties and the uses of aluminum hydroxide gel. Then storage of aluminum hydroxide gel. Then second one is magnesium hydroxide, MgOH twice. The another name is magnesium hydroxide. Then we discussed properties. It is colorless, odorless, melting 3500 degrees Celsius. It is insoluble in water, etc. Then magnesium hydroxide preparation. Magnesium salt plus basic water gives MgOH twice. Then mechanism. Then catharatics. The definition of catharatics are the drugs which gives relief from constipation, or these the drugs which brings defecation. Then mechanism of catharatics. Then laxative or substituents that loosen stools and increase bowel movements. Then the classification of antacid. First one, laxatives. There are two types, bulk producing drugs and stool softness. Then second one is strong purgatives, irritant or stimulant purgatives. Then saline catharatics. There are two types, sodium containing products and magnesium containing products. Sulfur cathartic and non-official catharatics. Then magnesium sulfate, MgSO4 7H2O. Another name is Epsom salt. Then uses of magnesium sulfate. It is a saline cathartic. Okay, then so on. Storage. It is stored in dry light container in cool place. Then kaolin, molecular formula Al2O32SaO2 Then the physical properties we are discussed. Then uses, and next one is bentonite. Then next one is disodium phosphate, Na2HPO4 7H2O. Okay, then we discussed bentonite properties and purity, then assay and application. Okay, students, thank you.